Hello everyone, I'm Sang-Hoon Lee at Kyung University, Seoul, Korea. Today's topic is the East-West medical collaboration for integrative medicine. First, let's think about the future of medicine. Can you guess what it look like? Most people say it will be a super aging society. As you can see this picture, there will be many older people and fewer children. A super-aging society means life expectancy is much longer than it is now. But would we be unconditionally happy to live longer? Probably not. If someone lives longer in uncontrollable illness or pain, it will be a disaster, not a blessing. So Martin Luther King Jr. said, "The quality, not the longevity, of one's life is what is important." P4 medicine is the main keyword for future medicine. P4 refers to predict, prevent, personalize, and participate. Some say holistic medicine. We need to take care of our whole body, mind, food, exercise, and everything. Integrative therapy is one of the patient-centered components. What is integrative medicine? Integrative medicine emphasizes relationship-centered care. It integrates conventional and complementary methods for treatment and prevention. It involves removing barriers that may activate the body's innate healing response. It uses natural, less invasive interventions before costly, invasive ones when possible. It engages mind, body, spirit, and community to facilitate healing. It maintains that healing is always possible, even when curing is not. The concepts of traditional and alternative medicine differ in the West and East. In the West, traditional medicine, like acupuncture or herbal medicine, is considered part of alternative medicine. However, in Asia, traditional medicine occupies an important part separate from alternative medicine, and it has its own regulation and education system. There can be several types of integrative medicine. Biomedicine-centered one is biomedicine treatment plus complementary treatment, like acupuncture and herbal medicine. Traditional medicine-centered one is traditional medicine treatment plus examination and procedures in biomedicine. Combination style is traditional medicine and biomedicine is utilized together in all processes. And as occasion demands, independent or combined whenever necessary. In 1972, Kyung University Hospital succeeded in acupuncture anesthesia. More cases included appendectomy and gynecological surgery. It would be one of the examples of East-West medical collaboration. Since then, we developed our own East-West medical collaboration. There is a round table in the collaboration center. The middle chair is for a patient. The other two chairs are for a biomedical doctor and a traditional medicine doctor. They are talking together to find the best solution for their patient. If patients have more structural problems, a surgeon or medical doctor has a priority to take care of them. However, if patients have more functional problems, traditional medicine doctor has a priority to take care of them. Let's see advantages of East-West medical collaboration. In academic aspects, it can provide abundant new ideas for the research topic. In clinical aspects, it expands its range to intractable disease, chronic disease, and common disease, which the cure is not yet developed. In economic aspects, it can save time and money for patients. If a biomedical doctor and a traditional medicine doctor come together for a patient at the same time, the patient doesn't have to go here and there to find a better solution. This can save time and avoid duplicate costs for consulting and examination in each clinic. This photo shows members of EastWest Arthritis and Rheumatism Center. They are acupuncture specialists, orthopedic surgeons, rheumatologists, clinical nutritionists, physical therapists, and nurses. The team can provide comprehensive treatment to patients including acupuncture, herbal medicine, biomedicine, surgery, patient education, and physical therapy. Based on our experience, there are some advices for establishing a new center for integrative medical collaboration. Firstly, strong leadership is essential to managing such a large team of varying qualifications. Secondly, until the system is settled down, early members should be able to reduce the burden of previous work and focus solely on medical collaboration. For your information, the following are some papers presenting the result of the East-West medical collaboration in Gyeonggi University. Electroacupuncture and moxibustion improved antispastic effect in stroke patient. Intradermal acupuncture on Shanman and Neiguan acupuncture point improved insomnia in patient with stroke. Now let's talk about the challenges for integrative medicine. According to a survey, 43% of people mentioned that the lack of mutual understanding was the biggest problem. The second is the need for research and verification of integrative medicine. In spite of the problems and challenges, there are many advantages of integrative medicine. Change in trend in acute infection to chronic degenerative disease, especially in superaging society. Need for a variety of medical services, global trend in alternative and complementary medicine, improvement of treatment effect through synergy, saving patient cost and time by avoiding duplicated treatment, government healthcare cost saving through prevention. Suggestions for successful integrative medicine. Number 1. Education for mutual understanding. Basic concept of both medicine at school or continuing education. Diagnosis and treatment method of both medicine. Mutual respect among medical professionals. Evidence, protocol, guidelines are necessary. Number 2, improvement of cooperation system. The most important concept is patient-centered thinking. Directors' leadership and administrative experts are also very important. Coordinators' guidance on whether or not patients receive integrative health care. Motivation for integrative medicine. For example, incentives or promotions. When there is hope, hope can change everything. So far, I have briefly talked about the advantages and advice for integrative medicine and East-West medical collaboration. There is a saying in Africa, if you want to go fast, go alone. But if you want to go far, go together. I think this message is important whenever we plan a new collaboration. I hope we can build up patient-centered integrative medicine together. Thank you for your attention.